This is our 20th anniversary from the inception of the clinic. We see kids for physical exams, sports physicals, vaccine catch-up. We have been seeing a lot more kids for mental health concerns. We try and collaborate with the families, teachers, the counselors to make sure we're providing seamless care.
Historically, the school-based health center serves around 1,600 students a year. That was before the COVID pandemic. About maybe 70–75% of that, I'd say, were medical visits, and the other 30-ish% were mental health. That has changed quite a bit now that we are in the pandemic. This past year, we saw about 2,700 visits, so much more, mainly due to COVID testing and then offering COVID vaccinations. We've been seeing all students from all three schools, their siblings, their parents, the teachers here, the teachers' families, janitorial staff, all sorts of people that are involved in the school.
We began in 2002. Members of the guidance department and our school nurse and others who were going to be involved in that were be part of that initial planning and even hiring, so that they would feel too that we're all in this together. We're going to do these things. We can share a common vision for the health and welfare of our kids. We have great psychologists, great counselors, great social workers, but it's never quite enough to meet the social emotional needs of our kids. Many of our students are not connected well, if at all, to the healthcare system. This is a serious matter. Also, adolescent healthcare is always frightening. Kids don't want to talk. Nope. And so, but when you're on your own, when you can establish your own connection to a doctor and also feel some level of privacy about that, then that's a much better thing. It's very fruitful, and it's certainly proved to be that.
I do see the vast majority of my patients across the street at Advocate. The barriers to a lot of these kids accessing their care are huge.
My 14-year-old son, he's a freshman. I didn't have anything like this in Chicago public school. It gives the kids a sense of comfort. They don't have to move from site to site. They can actually get things done here on site and get back to class.
I can go from one of my classes to basically a hospital very, very quickly. The medical service here is top-notch. They go above and beyond for all their patients, especially me. And I really appreciate it. I know that just right above me is the school that I've been going to for 4 years, so it really helped me, keep my mind at ease, and it's a familiar place for me to feel safe in.
If I were ever sick, I would always come here, because it was almost like I treated the school-based health center as my primary care area, and I think my siblings felt the same. It almost gave me the autonomy, or it was my responsibility to take care of my own care. They would understand me more because they interact with my age group.
The state's support for a school-based health center has really remained flat for the past decade. There's a grant of about $123,000. That grant hasn't changed. All of the cost increases have gone onto the district to kind of supplement and support the school-based health center. There's talk about that grant going competitive, which means that we might not be guaranteed to get that grant year after year, which would be completely devastating. We'd have to pull back some of these services to students if we didn't get additional support and funding. So we're always looking for any way that we can help support the school-based health center.
We've had life-saving, not only life, and changing events happen through our school-based health center. Just astonishing. It affects so many people so importantly. To be able to be well, to do well.